Welcome to the KISSBCP webinar series, where we discuss all things that relate to no building scenarios, to no people scenarios, no third-party supplier scenarios, and lastly, no systems, all combined to create Chaos the Dragon, which is battled by King Phoenix and his shield.
Good afternoon, everyone. I'm Don Brennan with Continuity Insights, and I'd like to welcome you to today's webinar, 15 Things You Need to Know Now About the Pandemic and Its Ongoing Impact on Our World, which will be presented by Roswitha Firth of Plainspoken BCP and sponsored by Kingsbridge BCP. COVID-19 has exposed some vulnerabilities in the lean business model many did not predict. The past 6 months have been a steep learning curve for the businesses that relied on the just-in-time supply chain practices. By looking at what we've learned from the pandemic and where we are now, we can take advantage of this information to better prepare for the future with and without COVID-19. So today, we'll walk through 15 things you need to know now to make sure that you're more prepared than ever for the next business interruption to avoid making the same mistakes again when the next disaster occurs. Before we get started, I just wanted to let you know that you will have the opportunity to participate in today's webinar by submitting questions through the questions pane of your control panel. You may send in your questions at any time during the presentation. We will collect these and then address them at the end of the presentation. In addition, if you feel that your question may require a more detailed explanation that can adequately be covered here, be sure to email Roswitha with your question and she will respond to you directly. Today's webinar will also be recorded for later on-demand viewing, and as a registered participant, you will receive a link to this recording. I would now like to introduce today's speaker. Roswitha Firth, founder of Plainspoken BCP, is a business resilience thought leader who has provided acumen, analysis, and experience in business continuity, disaster recovery, and crisis management to global companies for 20 years. Today, she'll walk us through the 15 things you'll need to know now to make sure you're more prepared forever for the next business interruption to avoid making the same mistakes again when that next disaster does occur. Please welcome Roswitha Firth.
Good afternoon and welcome. Thank you for joining this webinar. We appreciate this opportunity from Dawn, Continuity Insights, as well as Kingsbridge, for all of us to learn from each other. We're facing unprecedented situations, particularly around responding to simultaneous disasters. Frankly, it's surreal. Between the pandemic, vast wildfires, hurricanes, flooding, economic woes, and civil unrest, as individuals and business continuity professionals, we're stretched extremely thin. The purpose of today's webinar is to give you the information you need to leverage the current pandemic to increase awareness and preparedness for all threats. We are going to take a look at what we've learned, what the landscape looks like now, and where we're headed in the future to better equip you for whatever challenges lie ahead. First, I'd like to take a minute to tell you a little bit about Kingsbridge. Kingsbridge is primarily a software company that has been operating in the BCP space since 1983, with their featured product being the flagship Shield software as a solution to help you develop and maintain your business continuity plan. With that tool, they also offer a suite of communication tools to help you stay in touch with your organization, as well as a mobile app that syncs with our software as a service tool so that you can always have a current copy of your plan, even if there is no internet or cell service. While Kingsbridge's primary focus is on software, they still provide a range of professional services, including business continuity mentoring hours that are included with a subscription to their Shield software as a service tool. It's through these professional services that they've seen a lot of mistakes, so it puts them in a unique position to be able to gather and share those with you so that they can try to prevent history from repeating itself. Today, we're going to cover 15 things you need to know now about COVID-19 and uncertainty, key points of what we've come to know and love about the new normal, and where this will likely lead us in the future. And at the end, we'll have some additional resources for you and take time for questions, as Dawn mentioned. With so much information to wade through about our constantly changing world during this pandemic, our goal is for you to leave today better prepared for the next business interruption. Before we dive in, I just have to start with the crazy. I read on CNN yesterday about the zombie tropical storm Paulette returning from the dead because, of course, it's 2020. If that isn't the poster child for this year, I don't know what is. I'm beginning to think I should have added Apocalypse Bingo to our discussion on the new normal. Now, let's get started. So what have we learned? Well, we can no longer say it will never happen. More importantly, the people holding the purse strings can no longer say it will never happen. We'll talk a bit later about taking advantage of this. COVID-19 has brought about the largest societal behavior shifts in decades, some of which are predicted to be permanent. Technology, leadership, and companies needed to change overnight in response to the health threat. Many companies are still in reaction mode. 8 months in, fatigue has gained a foothold. But now is not the time to let down your guard. To survive and thrive, we must make the effort to simplify during complexity and uncertainty. If you've been in the business continuity field for a while, you may have written plans for or had to respond to other recent pandemics such as H1N1 in 2009 or SARS in 2003. What we've seen is history just repeats itself. We'll talk briefly about what these have in common with severe acute respiratory syndrome coronavirus 2, officially SARS-CoV-2, what we all know and love as COVID-19. The number one thing that these three viruses have in common is very simple. We tend to get surprised every time we have a new outbreak of a virus that causes a pandemic or an epidemic. All three of these are viral respiratory illnesses spread primarily through airborne droplets from human to human, but history may repeat itself, and then it doesn't. The key differences to recognize are as follows. First, transmission and mortality rates differ between these viruses. So far, we have either dealt with low transmissibility and high mortality rates, or diseases that are highly infectious but have relatively low death rates. COVID-19 is very contagious, and yes, the numbers are very severe, but compared to MERS, it has a low fatality rate. Second, responses to previous pandemics relied on hygiene and sanitation measures such as hand washing. COVID-19 is unique in that it has required the use of lockdowns, physical distancing, and other measures that disrupt economies. Third, COVID has had a far larger global impact than even H1N1. Next, we're going to take a look at what has worked and not worked worldwide. Let's start with the obvious. It's the answer most of us don't like hearing. The best way to prevent illness is to avoid being exposed to this virus. That gets overlooked a lot in a lot of the messaging because most of us have COVID fatigue. We want it to be over, or at least over enough that we can feel like we've returned to something that resembles normal. And of course, realistically, many people can't stay home because of their jobs. Jobs in healthcare, public safety, manufacturing, and transportation are the obvious ones, but where would we be without the sanitation department? With this in mind, I'd like to quickly review what we know helps prevent the spread of COVID-19. Since airborne viruses, including COVID-19, are among the most contagious and easily spread, the more closely a person with COVID-19 interacts with others and the longer that interaction, the higher the risk of COVID-19 spread. Therefore, it's important to practice everyday safety actions. Limit your exposure, practice social distancing of at least 6 feet from others, wear masks and wear them properly when you have to go out in public, avoid touching your face and mask, wash your hands frequently with soap and water for 20 seconds, or use a hand sanitizer with at least 60% alcohol content, and wear a mask when you have to go out in public. Wear gloves for cleaning, disinfecting, and when caring for the sick. Masks, however, should not replace other prevention measures. When we can't stay home, All of the preventative measures we've learned about do work best when combined. As in business continuity, it's all about managing and reducing risk. If you have to be around people, do what you can to minimize risk of becoming infected, both for yourself and others. The CDC also provides specific guidance for households living in close quarters, living in shared housing, such as on campus, and for certain disability groups. What we've learned, of course, is that science evolves. Under any circumstances, early experimental results may differ from the final conclusions. The scientific method is based on the idea that one has to get the same results repeatedly, and other people have to be able to repeat what you've done and come to the same conclusion. Otherwise, the findings aren't considered sound. They may deserve further study, but generally this information isn't made public. Science is about reducing uncertainty. Therefore, while research is a process, we don't normally hear about results until after copious data has been collected over multiple experiments by different research teams and after thorough peer review and publication. Peer review is extremely time-consuming. However, the availability of open access journals for preliminary data means that scientists can view findings that haven't gone through the full rigorous process yet. The rapidly evolving global crisis, especially in the first months of the pandemic, meant that everyone was looking for answers to protect public health and contain the disease. This urgency around COVID-19 has resulted in public access to preliminary results of research, resulting in confusion and contradiction in both public health policy and messaging. In some cases, this has had very unfortunate results. Let's start by acknowledging that best practices change, and it's frustrating. It's also true. We have in fact been presented with information that conflicts with some of what has previously been published or disseminated. We've talked about one of the reasons why. Other important factors, play a role. First, let's recall that the science changes quickly with new information, and there are lots of unknowns. Next, recommendations from public health have to consider implementation across the whole of the communities they're responsible for. This means that guidelines not only have to work, but they also have to be practical to implement, or else people will not consistently follow them, resulting in low rates of success. One of the factors complicating this is that humans have what's called intuitive knowledge. These are useful shortcuts for learning under most circumstances, but when it comes to learning about a new virus, that intuition can lead to important misconceptions, even in people with formal scientific training. Best practices put out by public health agencies are based on the best understanding we have at the time. I do recommend keeping up to date on multiple sources such as the WHO and the CDC. Last, if you have a part in messaging or training that employees receive about COVID-19, keep in mind that the most effective recommendations won't be followed if the message isn't simple and direct. Adding a caveat about, quote, the best understanding we have now, unquote, can help prevent people feeling like they shouldn't listen to the guidance because all of these changes feel wishy-washy. And finally, we've learned that life does go on. 8 months in to the pandemic, fatigue has set in, but do not let down your guard. Follow public health guidance to stay safe, and keep an adaptive mindset as you face challenges. Resilience isn't just about business, it's about you. Just because we are in a pandemic does not mean the world isn't continuing and continues to evolve the pandemic response and throw new disasters at us. Saying it will never happen here has been debunked so thoroughly that we're at a unique point in history. You, as business continuity professionals, practitioners, have a window of opportunity to grow your organization's resilience to ensure survivability and growth. So what is the new normal? Everyone is having to manage new constraints. COVID-19 exposed vulnerabilities in the lean business model many did not predict. Huge increases in tech and online shopping, severe losses in the hospitality sector, bankruptcies in retail, and pivot industries like clothing companies manufacturing masks have changed both business and industry, as well as our personal lives. From canceled flights and travel bans to shortages at the grocery store, COVID complexity seems to be everywhere. To make things worse, we have disasters happening during a disaster. It's crucial for both mental health and business success to make an effort to simplify during this complexity and uncertainty. I'll begin with a major game changer, work from home. We have witnessed what will surely be remembered as a historic deployment of remote work and digital access to services across every domain. The stigma associated with working from home prior to COVID-19 has disappeared. According to Stanford University, over 40% of the US labor force is now working from home full-time. Other statistics I came across put that number much higher, but measured other criteria such as remote working at least half the time or the time frame from March until June. Now, in March of 2020, the average daily in-home data usage increased by roughly 40% over the same month in 2019. Bandwidth usage has seen a giant increase. Since the beginning of March, national upstream growth in broadband is up over 30%. Consequences of this include slow bandwidth at home when parents work and children are learning virtually. On the business side of things, companies have faced unexpected costs for remote work reimbursements, which I'll talk about in more detail later. So the US Bureau of Labor Statistics provided this information. These numbers are astounding. While they're not permanent, no one is expecting a return to pre-shutdown numbers, not by a long shot. As you can see, the levels of remote working, although they vary tremendously by industry, you'll see that the percentage points in most of them are fairly comparable. Most companies are dealing with new challenges. New policies are needed around bringing equipment home and sanitizing that which is returned. Employees report being more productive, yet how are companies measuring work from home productivity? Some use video playback of work, VPN monitoring, and dashboard tools. And then there's the question of how do you monitor employees? Employers are both keeping track of what employees type, recording internet activity, as well as taking screenshots. These are issues that companies are grappling with. At the same time, they may be looking at how to survive or position themselves for new market opportunities. Nevertheless, the productivity increase is estimated to be worth about $1.3 billion. Next, let's talk a little bit about Zoom and Microsoft Teams. Use of Microsoft Teams grew by 894% compared between February and mid-June. During that same period, Zoom use grew by 677%. Employees who are remote working are exhibiting growing collaborative application sprawl, with employees using several tools to serve similar needs. So for example, having calls and meetings via Skype, Zoom, or Microsoft Teams, and then using apps for messaging chat that vary depending on the circumstances and what their needs are. Let's talk a little bit about travel. Business travel isn't dead, but it is extremely limited and likely to stay that way. The use of Zoom has proven that most meetings can be held virtually and be successful. Sales presentations no longer require any face-to-face meetings. Companies will want to save money on travel and therefore will likely scrutinize any plans for business travel that's not considered absolutely crucial. Overall, travel will remain down well into 2021 as case numbers spike in different parts of the US and the world. U.S. Airlines passenger enplanements reached 16.5 million in June of 2020, down over 80% from June of 2019. That's absolutely staggering. The number in 2019, June, was 72.8 million. I don't know about you, but I'm very much looking forward to being able to get on a plane again whenever I want to. So worldwide, one side effect has been that the decline in travel has resulted in less weather data because fewer planes have been flying, and therefore we actually have less accurate weather predictions. This is hopefully a short-term impact. Now, let's look at changes in the workforce that we've seen. Now, a distributed workforce helps business continuity planning by lessening the exposures. If your employees aren't all in one place, they won't be affected by the same incidents, such as a fire in the building, protests, or other incidents. Companies that continue large-scale remote working have access to more talent. They're not geographically limited by the employees that they hired, which further reduces risk for certain types of disasters. On the other hand, certain impacts are actually heightened, for example, power outages. And of course, a, quote, no people loss can no longer be considered to just be 5 days. Now, a new way of looking at a loss of workforce can be taking the number of employees out who are out because of the disease itself, plus the number of employees that have been laid off and whose job functions may not be getting done, plus employees choosing to leave either to care for sick or elderly relatives or to stay home with children. These losses can both affect and be affected by the decision to halt non-critical jobs. As part of this, it's extremely important to change how you think about key people. Successful business continuity plans will focus on the function, not on the person. So what does all of this tell us? It's the perfect time to do business continuity planning. You may read or have heard about the prediction that the window for increased awareness and willingness to spend money around business continuity is about 6 months. If you want to upgrade your business continuity plan, you can use Kingsbridge's free tools, a return on investment calculator to help you build your case for business continuity, additional staff, and software for planning. Free business continuity planning software, and if you would like more help, you can also access free training, checklists, and questionnaires, which are available at kingsbridgebcp.com/bcp-academy. Some things to consider. First, if you don't already have a good relationship with your IT department, now is the time to put forth the effort to improve the situation so you can work together more effectively. It will make your life easier and your organization stronger. Second, Zoom isn't just for meetings anymore. It is also a very useful tool for training and cross-training. Documenting procedures for business continuity and disaster recovery has never been easier. You can video a talkthrough of the steps for a particular procedure and store it with your business continuity plan. Not only is it more user-friendly, this can be completed much more quickly than standard written documentation, which is not to say that you may not wish to supplement with some documentation, of course, but this is definitely a useful tool to take advantage of. And third, identify your business continuity planning needs, such as software. Calculate the return on the investment and ask for the money now. What does the future really hold? New and different risks await. With the recent surge in digital adoption by both consumers and business, change is what we have to look forward to. Just as in our personal lives, an adaptive mindset is a must. Companies who wish to remain in business and grow must promote this mindset within their organizations. Take the time to look for the opportunities. Get out ahead. Don't be reactive. We have a unique opportunity to take advantage of a very challenging situation to improve our resilience, both for ourselves and for the companies that we work for. The number one best business practice is still to take care of your employees. We've all heard that if you take care of your employees, they will take care of you. It's true. There are countless company stories that illustrate this. What must follow from this is that prioritizing people's health and well-being must be reflected in your business continuity plans. Expect a shift to personal ready at home instead of office ready for usual events like earthquakes. If you're using any kind of mass communication system, that may be an opportunity for you to educate your employees about what it means to be ready at home and help them be better prepared for unexpected events. Expect significant changes in human resource policies. Companies will need to address employee costs of everything from internet plans to developing a policy for reimbursement. There are legal ramifications to this depending on where your business operates. These expenses may include a portion of the employee's cell phone charges, landline phone bills for those who still have them, internet or data plan charges, costs attributable to plan overage charges, the use of purchase of a computer or laptop, teleconferencing software or hardware, postage costs, fax machine or other services or equipment required for the job. Now, I mentioned a portion of these expenses because typically where there are laws about this, the expenses are described as being reasonable expenses. Nonetheless, it is a significant expense that many companies will have to absorb. In a recent survey of around 1,400 US-based companies, more than 1 in 5 say they are helping to pay for their employees' home office equipment. That's as of today. Going forward, that number is expected to be much higher. Meanwhile, nearly a third of companies say they are reimbursing their newly remote employees for their laptops, and more than 14% are paying for their ergonomic office furniture, according to a recent survey. More than 10% are covering their workers' internet bills. Sick days will largely be replaced with personal days. This transformation has been happening for years, but work from home will kill off sick days for most salaried employees and many hourly ones. Expect to see sick days linger where the majority of employees must go to work, such as factories or warehouses. Sadly, this means the snow day is dead, but long live the personal day. There's new challenges in security regarding remote working security risks. There are significant risks associated with this. Over 40% of US-based companies allow employees unrestricted access to sensitive data. Of all the alarming statistics that I found in writing the information for this webinar, that one truly shocked me. Additionally, almost 90% of businesses have over 1 million folders, but do not limit employee access to company files. Now, personal device policies will need to be updated to reflect the changed work environment. And as I'm sure you're aware, cybersecurity failures are on the rise, and these will be affected by working from home. One notable area is in custom-developed web apps, custom-coded, custom-created productivity apps for operations. These have a higher rate for exploitation because of weak authentication at both the system level and the application level. And the reason that this matters as much as it does, aside from loss of sensitive data and reputation loss, is the average cost of a data security breach for a major business is anticipated to be over $150 million. Organizations take an average of almost 200 days to detect data breaches. And per the FBI, the number of cyber crimes that are reported account for only about 10 to 12% of the actual number occurring. All of this emphasizes the tremendous need for evaluating not just cybersecurity in general, but those particular challenges faced by people working from home. Okay, let's talk a little about office space use and changes. We're expecting adjustments to office space, but will it be more or less? In many cases, it's likely to be both. On the practical level, additional cleaning protocols are required. There are safety concerns around mass transit and issues with elevator capacity when social distancing measures are necessary. So depending on the number of people returning to work, a company may need more space because they're spreading people out more. This is likely to result in a shift from employees working downtown to employees working in the suburbs in low-rise office parks. That alleviates both some of the social distancing issues as well as the safety concerns around mass transit. One point of discussion around this is, should companies be spending money gained from any reduction in office space because they've chosen to have people work either partly or entirely from home? Should they be spending this money on generators for critical workforce to increase resiliency and reduce downtime? I'm a big advocate of this, and I feel it's definitely worth exploring if you can include this in your conversation about what's needed for resilience at your company. Now, whether or not to go back to the office or not is partly a cost decision. A typical employer can save an average of $11,000 per half-time remote worker per year. The primary savings are the result of increased productivity, lower real estate costs, reduced absenteeism and turnover, and better disaster preparedness. Now, employers can calculate their own potential savings with a free telework savings calculator, which is publicly available. You have to register, but it's free. But a report to Congress referred this as a very comprehensive and based on solid research. So I recommend you check out this tool, which I've included the link in the resources at the end. Now, in cases where employees are returning to the office, how do you come back safely? Companies are implementing various procedures for their workforce. Depending on the decisions about whether all or part of the workforce is coming back, there's decisions about staggering employees, booking time in the office to ensure adequate social distancing, regular temperature checks, and a new elevator policy. There's also sanitation procedures to consider when coming back to the office and factoring in the additional janitorial costs for this, which are not insignificant. And finally, let's talk about technology investment. When survey respondents were asked about the business outcomes they are prioritizing over the next year, increasing employee efficiency and productivity was the top priority, even more so than cutting costs. 54% of the respondents believe employee service automation, such as the IT help desk, will be key to organizational resilience. Now, there's other opportunities for technology investment. Depending on the sector, there's more investment being done in R&D. In other areas, there's much less investment in R&D, with companies taking the opportunity to increase their market share in other ways. So to summarize, while more information is available every day, the global health situation is not on a linear path. Pivot and adapt have been permanently embedded in our lexicon for good reason. Major shifts in technology and how companies do business will continue to have ripple effects on society and how we practice BCP. Take what you've learned to be ready for the next business interruption. As Eisenhower famously said, plans are nothing, planning is everything. And don't delay, ask for that funding. Now, a note about seeking expertise. Look for experts, vet your sources. A Facebook spokesperson said that Facebook applied warning labels to 98 million pieces of COVID-related misinformation from April to June of this year. And verify the information that you're reading. On the screen, I've put some additional resources for you. The first one is the Venn diagram that I showed about daily life coping, and it also includes other information about making decisions about when and how to go out. And the remote work savings calculator is available. That is available for both employers and employees, so that you can also log in or register and see how these savings might affect you. I believe they're significant for employees as well. Now, if you have questions about the free software and tools from Kingsbridge, their contact information is on the next screen. I'm going to leave this here for just a second. I think a new way of thinking about pandemics is crucial, and Dr. Wenzel says it very well. And here's the information to contact Kingsbridge for any questions. And thank you for your participation. I hope you found this webinar valuable in making sure you're more prepared than ever for the future, with and without COVID-19. We have time for a few questions, so I'm going to hand this back over to Don.
Okay, thank you, Roswitha.
Thank you.
Excellent presentation. A lot of great information there. Yeah, right now we do have some time to field a couple of questions, and I want to remind everybody who's been listening in today, you can still submit questions using the questions pane in your attendee control panel. So our first question, Roswitha, is, does cybercrime need to be in my business continuity plan?
That's a great question. I think absolutely. That would obviously be something that you would work on with your IT department, but having a business continuity plan is critical in the face of a data breach. A plan would outline the type of data being stored, where it's stored, and what those potential liabilities are when implementing data security and recovery actions. These incidents can be either criminal activity or human error or a mix of both, but the most common cause is the failure of organizations to prepare and do assessments in advance to identify their weaknesses. So having cybercrime addressed in your business continuity plan can help prevent those issues. So yes, I would absolutely encourage that.
Okay, thank you. Our next question is, what else should I consider when discussing plans with IT?
So in addition to cybercrime, I would also look at discussing costs with IT when you're looking at especially your return on investment for your business continuity planning. Companies have found that during this particular crisis, there's the potential to free up in excess of 40% of IT costs over the course of a year. So this is partially, for example, extending hardware and software refresh cycles, renegotiating vendor contracts. These types of things can impact what's in your IT disaster recovery plan and how it's executed. So I would definitely take the time to sit down, regardless of the industry that you're in, and looking at what potential changes are coming for IT and how that impacts the business impact analysis, as well as your overall risk assessment.
Okay, thank you. The next question, I think, is a follow-up to that, and it's
okay.
I believe it is. Should I try to organize testing with things the way they are?
Yes, there's no getting away from regular testing of your BCP. You should continue to test and train your business continuity plans using a combination of tabletop and simulation exercises. In a way, particularly tabletop exercises will be easier to schedule because employee availability right now has actually increased. People are having fewer meetings. So you may be able to get greater participation since many people will be working from the comfort of their own home. Simulation exercises as well should be conducted. Excuse me. They may be a little different than what you were doing when you were in the office, but taking the time to put people through the process of what happens if, and doing an actual simulation, especially if you're going to include things like a power outage and how that gets responded to, I think is a very valuable use of your exercising time. And then in addition, I'd recommend coming up with new ways for exercising your business continuity plans, given the fact that so many people are working from home. So there might be new opportunities there.
Okay, great. We had a couple more questions that just came in. Maybe we can address those quickly. First one is, what calculators do you use for business impact versus IT spend?
That, I think, is definitely variable. As far as your business impact analysis, doing a return on investment calculator, I think you can plug in both kinds of numbers to give you a sense and ammunition to take with you when asking for funding. Obviously, IT needs to be involved and really should be the driver for their part of things. I'm not sure if I answered the question, so if I can provide more information, I'm happy to do so. I'm just not sure of exactly the scope of the question beyond what I've said.
Okay, well, thank you. Yeah, if our person answered that question, if they'd like more information, I just want to remind you that you can contact Roswitha directly, and she can follow up on that for you.
Happy to do so.
One last question we have here, and this addressed something, I think it's a semantic discussion, but you can tell us, is early on when you were talking about working from home and telecommuting, what do you see as the difference between those, or are they actually the same thing?
So there's work from home and remote working are considered the same thing, just a different way of saying it. Teleworking, that terminology is apparently largely been replaced, although the calculator that I provided, that still uses that term officially. But I was reading about this because I found it interesting. And of course, we have to make life confusing with different terminology and jargon and things like that. But there is a difference between teleworking and telecommuting. My best understanding of this is that when you bring work home to do, that is teleworking. When you are working from home instead of commuting, that is telecommuting. I'm sure I could probably Google this again and find the opposite answer. I don't know that it's terribly significant at this point, but at some point in the past, there was a distinction. Those two terms, teleworking and telecommuting, came from someone whose name I don't recall, but they've actually been around since like the 1970s. But for our purposes, teleworking, telecommuting, working from home, and remote working are essentially the same thing. Remote working is nice because it broadens the idea that you could be anywhere, not just at home, and still be logging into work.
Okay, great. Thank you. I was one of the folks that was wondering about the difference there, and I think you helped answer that for me.
Great.
Unfortunately, we've run out of time today, today's presentation, but I just want to remind everybody that if you do have questions we didn't get to today, and there are a couple of them, or if you think of new questions, you can reach out to Roswitha at the address that's currently being shown on the screen. I want to let everybody know that we'll also be posting a recording of this webinar on the Continuity Insights website in a few days if you miss any part of today's broadcast or if you'd like to share it with your colleagues. Additionally, when I follow up to let you know about the availability of the webinar on demand, I will also be giving you a copy of today's slides. I've had a number of requests for the slides as well. There's a lot of good information in them. And I will also include the links to the additional resources that Roswitha mentioned earlier. So as we wrap up, I want to thank you again, Roswitha. And I want to thank everybody for attending today's webinar, 15 things you need to know now about the pandemic and its ongoing impact on our world. On behalf of Continuity, thank you, Roswitha. And also on behalf of Continuity Insights and our corporate sponsor, KISSBCP, thank you for joining us and enjoy the rest of your day.